A line manager would become aware of any issues with an employee if there was any behavioural change, performance issues, difference in character.
It can start from the point of referral. So a manager has identified that there's a health issue with the individual, and this can either be that they've become absent from work, either short-term or long-term. It can be that they notice there's a change in the way that they're able to do their job role and their tasks at work. It could be a change in behaviour. So the first thing that the manager would do would be to send a management referral online to the occupational health team, where upon receipt an appointment will be made to be assessed by one of the clinicians.
I think line managers should be mindful that when they're talking to employees about health issues, that it is from a colleague to colleague perspective and not as a friend to friend. As this can often set the wrong footing. I think it's important to remain professional, and then you gain the trust and confidence that will then allow the employee to engage and communicate openly with you about the health issue. There may be some situations where an employee finds it difficult to discuss their health condition with the line manager. It's therefore reasonable for the line manager to ask the individual if they're comfortable discussing the condition. If not, they can always ask another line manager to come into force, or they can be referred directly on to occupational health without having to disclose the health issue with the line manager directly.
A line manager should think when approaching an employee about a health or wellbeing issue is the first thing to not be afraid to address the issue. It's about opening up dialogue, it's about sensitivity when you're talking to your employee, it's about having the conversation in the appropriate place, so a time when it's private, that the employee's got time to speak and feel secure that they can disclose issues that are going on in their life. If the manager were to say something wrong, my primary advice is to all of us really is that it's a learning curve, and what you would have to do is reflect on it. Okay, how could I've had that conversation better? Clearly that's not worked out how I want to be. It's about recognising when you might have overstepped the line and taking it back and look, I apologise, I didn't mean to cause upset, but what I do need to do as your line manager is explore these issues with you and look at how I can help you within the workplace. If you do hold the conversation and the employee refuses to engage, there are several aspects that you can look at. You can always see if they would be more comfortable talking about it with somebody else. For instance, your specialist team, like the occupational health team. Is there a HR team? Is there another manager that they might feel more comfortable? So look at all your options really. Clearly, if the employee, you can only work on the information that the employee gives you, and if they don't want to engage, you can only work on that information that you have. It's very important to keep in touch with an employee when they're absent from work. And an employee should also be aware that they have contractual obligations to keep in touch with the employer. You should open up the initial point of contact, what we advise is the first day of absence, and from there you can ascertain the reason for their absence, and going forward, when appropriate, points of contact would be made, and this helps with discussions about what other advice that you might need to be looking at. Once you've referred the employee to the occupational health department, it may be advisable that as an occupational health contact we need more information relating to the person's health status, so we might have communications with their GP or their specialists. There's also awareness of the employee assistance programme that you can refer your employee to, and that can help certainly deal with psychological health or well-being as well.
A line manager should be aware that there are support and services out there other than occupational health. If the health condition is more serious than first anticipated, we have employee assistant programmes in place, and also we have the ability to refer to a third-party specialist for private referral if that is deemed necessary. The EAP provider does offer support to management by giving them support in dealing with sensitive issues and health-related issues when discussing awkward situations with the employee.
In essence, the line manager has an essential role in helping the employee within the workplace. They are the interface between the employee, the occupational health department, the human resource employment law, and it's about making sure that channels of communication are kept open. If, as a line manager, you receive fitness guidance regarding your employee and a return to work plan, it's always important, and this goes back to the essence of communication, about ensuring that you've discussed with the employee about how you're going to implement the return to work. It's about reviewing it. Is it working? Isn't it working? Can we adjust it slightly? And linking in as well with the Occupational Health Department, getting clarity about the advice that is given so that you can use it effectively within your practice. When, as a line manager, you receive the return to work plan, our first point of advice would be that you actually discuss it with the employee. You make contact with the employee before the return to work date to discuss what happened in the medical referral and what the expectations are for when they return to work, what you can put in place. This is particularly important if, for example, the employee has a GP certificate that enables them to refrain from work until a certain date, but the occupational health advisor or physician has said, okay, I think we need to look at a return to work plan from an earlier date. So it's kind of negating any surprises when it comes to a return to work and helping with employee engagement with the return to work. What is to be remembered is that it's a guidance plan, it's a guidance return to work plan, and you can use it and adjust it with what your needs are as well. Again, as I said, you always discuss with the Occupational Health Department, is this advisable? The other key issue is talking with your employee. Okay, the doctor has advised these workplace adjustments. How do you feel about doing this? And getting their engagement with the return to work. With regards to what a line manager should say to the rest of the team, again, you have to deal with this on a case-by-case basis. You might find it's with the employee's consent, if it's something that they consent to, you might want to have a discussion with the rest of the team, about why this individual needs just some extra support or adjusted hours for this period. But if actually the employee does not want it disclosed or is quite uncomfortable with the discussion with the team, you just have to say to the rest of the team, look, I have to respect the rights of the individual not to disclose this.
Return to work plans are beneficial, however they're not set in stone, they're not rigid, and it is important that the line manager recognises this, and if the plan is flawed in any way or the employee doesn't manage to maintain the return to work plan as agreed in the initial report, the manager can then ask the Occupational Health Department to review the situation again so that the employee can be reassessed. It's beneficial for everyone to be involved, including the line manager, HR business partners and the Occupational Health Department, if there is a return to work plan that is going to be slightly more complex than normal. This can often take place in video conference calls by way of engaging the employee to ask them what they think their views are as to why the plan isn't working. So whilst it's a structured approach, it isn't rigid.